Great, recording in progress. Okay, so on to why we're all here tonight. So this call has been organised by the SOS NHS Coalition. And actually, sure, sorry, I should have introduced myself first. Hi everyone, I'm Hope. I work at Just Treatment, and I'm going to be facilitating the call tonight with Lucy from Keeper NHS Public, who you'll hear from in a bit. So yeah, this call has been organised by the SOS NHS Coalition. We're a group of health campaigning organisations who are united in fighting for a fully funded and truly public NHS where both patients and staff have the resources they need and our lives and our health are never sacrificed for corporate profits. Since the start of this year, as a coalition, we've been working together to raise the alarm on the deadly crisis of corridor care that is affecting hospitals across the NHS. This follows vital work that has been done over a number of years by the Royal College of Emergency Medicine, the Royal College of Nursing, Age UK, and many other aligned groups. Back in February, if you want to go to the next slide, Lucy, we organised a creative stunt outside Parliament, which there you can see it on the screen in all its glory, led by patients and health workers to spotlight the issue of corridor care and to demand meaningful action from politicians to bring an end to the crisis. That was just the start. Lots more work to do. But since then, corridor care has been in the news a lot, and the government has finally committed to publishing monthly data on the crisis, which we thought was going to be launched last week, but it ended up getting delayed. And so we think that data might be coming out tomorrow. That's what we've heard, but who knows? It's possible they might leave it till the very last minute, but they said that they would be doing that in May. So that's one to look out for in the next couple of days. And the government also renewed its pledge to end corridor care by 2029, though that was Wes Streeting who said that, who is obviously gone. So let's see what James Murray is going to have to say. But I think we were just talking before everyone joined the call. I think we can expect it's going to be a lot of the same, unfortunately, but let's see. But obviously, pledges and words alone, they're just not really enough. And the reality is that the health policies that the government has so far announced fall far short of what's needed to actually end this crisis. So the aim of this call tonight is to share information about the causes and the impacts of corridor care, as well as the solutions that are needed to truly tackle it. We'll also be sharing a new action that you guys can take right away to help put pressure on politicians. And we're thrilled, if you go to the next slide, Lucy, to be joined by a great lineup of patients, health workers, policy experts, and an MP to share their insights tonight. With corridor care continuing to be in the media spotlight, plus a new health secretary and a very turbulent political landscape, this moment offers a real opportunity to ramp up the pressure and to secure meaningful commitments from parliamentarians and the government. But that's only going to happen if we work together and if enough of us take action. So that's exactly why we wanted to do this call tonight. So to kick us off, we're going to hand over to John from Keeper NHS Public, who's going to outline some key facts that we all need to understand about the corridor care crisis and its causes. So over to you, John.
Okay, thanks very much, Hope, and good evening to everyone. I think probably everyone will know what corridor care is. It's treating patients or keeping patients in hospital hallways, corridors, or other places where you wouldn't normally have patients. And it can be in areas such as storerooms. It's even been in cafeteria and in car parks, and it's all because of lack of available beds. And these places, because they're not just corridors, sometimes they're referred to collectively as temporary escalation spaces. Now, what it does if you put a patient in such a space is immediately you're putting them at risk because they're not safe spaces. There's usually no privacy. Their treatment is delayed. And of course, their dignity is severely compromised. And in the past, years ago, this would have been considered only something that could happen or should happen in an emergency situation, but it's now actually become normalized in many hospitals. So if we look back to the year 2015, not that long ago, there were only 1,000 cases of people who spent more than 12 hours on a trolley waiting for admission after a decision had been made that they should be admitted to a hospital bed. Only 1,000 over the whole year. Last year, this had gone up to 550,000. This is a 500-fold increase over 10 years. Now, that is quite staggering. And I think it immediately gives the lie to a line from government that actually this is a local management thing. This is about lazy staff and managers who've taken their eye off the ball and they're not making sure that patients go through the system quickly enough. I mean, it's just unbelievable, this massive increase. So this isn't patients waiting to be seen and assessed in A&E. It's patients where a decision has already been made that they need admission to hospital because they're ill and because they need treatment. And the latest figures are from March and April. And in those 2 months, March and April this year, there were 46,600 in March, and it had gone up by over 1,000 in April. So generally, the numbers are still going up. And again, if you compare that with the past, April 2019, that month there are only 442 12-hour trolley wait. So again, a sort of massive increase. In that case, just over 100-fold increase. So corridor care, I think, can be taken as one of the most visible manifestations of just how much pressure the system is under at the moment and how it's actually failing patients. And emergency departments, A&E departments, are a bit like the canary in the mine. When things are happening there, it's telling you something is wrong. It doesn't tell you necessarily the cause of the problem. And it would be wrong to think you could fix everything by just focusing on A&E. They actually highlight systemic failures in the system. And this is really important to acknowledge in terms of deciding what needs to be done, given government pledges to abolish corridor care. And for example, if you don't have community and social care support, you can't discharge people from hospital in a timely fashion. That means beds are unavailable for patients who need admission. That means they stay in A&E or get parked in a corridor until a bed is found. And A&E is also full and finds it difficult to squeeze more people in. So you can find patients who are arriving in ambulance but can't be moved into A&E, have to remain under the care of ambulance staff who are then unable to leave and take the next emergency call. So this crisis in acute care is hugely important, but it hasn't received the attention from government that it needs. And perhaps a first step here has been an agreement that data will now be recorded, so at least the size of the problem will be measured. One of the reasons this is very important is because if you're sick and you need a hospital bed but you can't get one straight away, as time goes by, your chances of dying increase. So the Royal College of Emergency Medicine published data, peer-reviewed journal, showing last year that there was something like 16,600 preventable deaths directly related to delayed transfer from A&E to a hospital bed. That's 320 patients a week or 46 a day. And as Hope said, there's been a number of reports into corridor care from different organisations. The first one being early in 2025 from the Royal College of Nursing. They surveyed their members. Nearly 67% of nurses said they delivered care in corridors or unsuitable spaces on a daily basis. Over 90% believed that this compromised patient safety. And there were terrible, heartbreaking accounts describing patients dying in corridors, receiving end-of-life care without privacy, and of course the terrible impact, the moral injury that this caused for the staff involved. The Royal College of Physicians surveyed around 1,000 consultants and published a report. 78% had treated patients in temporary environments, such as corridors or waiting rooms, within the previous month. Doctors reported widespread inability to provide dignified or confidential care for their patients. And that report did frame corridor care as evidence of systemic NHS capacity failure. And then a major investigation by the British Medical Journal found 8 out of 10 NHS trusts in England were using corridors or makeshift spaces for emergency care, and at least 500,000 patients were reportedly treated in temporary spaces, and that possibly was an underestimate because not all hospitals provided the information. So it may have been as many as 1 million. One hospital treated 1 in 4 of its A&E patients in corridors, and some trusts have installed portable sinks in corridors along with heating, lighting, plug sockets, toileting facilities to provide care for the patients. And some hospitals have even created dedicated corridor nurse roles, working shifts, with one trust hiring extra staff to help oversee patients in temporary escalation chairs. And this is why some say that corridor care has actually been normalised. Age UK also reported on the experiences of older patients. They found there'd been a massive increase in 24 to 72-hour waits in A&E. So when we talk about 12-hour trolley waits, it's not that you get to 12 hours and that you've then got a bed. Some people wait a lot longer. And there were more than 100,000 instances in 2024-25 where over 65s waited between 1 and 3 days after a decision to admit. And there were reports of elderly patients left in reception areas or on chairs overnight. So, government has pledged it will abolish corridor care by the end of this Parliament, but there are worries that a focus on local management being made responsible for sorting things out means that the real causes, which are rising demand, bed shortages, delayed discharges, and lack of social care capacity and community support, that they're not being addressed. And I'll come back to solutions at the end of the meeting. Thank you.
Thank you so much, John. That was a really, really useful introduction, and sort of grounding of what we mean when we say corridor care, and kind of what's behind it. And the statistics you used were so shocking. And I think it's obviously very important to remember that behind the statistics, that are always horrible to hear, there are patients and families across the country whose lives are being sort of either put on hold or turned upside down, and in some horrible cases ending um, as a result or exacerbated by this crisis. So I think we at SOS NHS think it's really important to hear and amplify these voices, which is why we're really pleased to be joined tonight by Muge from Just Treatment and Claire from Frontline 19, who have had both had recent experiences of caring for loved ones that have been experiencing corridor care. So we'll start with Muge and then we'll hear from Claire. But Muge, would you like to?
Hi. Yeah, thanks for having me. So I'm going to tell you about my sister's story, which is very recent, about my own story, which is about 2 years old now, and a little bit about the campaigning that we do at Just Treatment. So I'll start with my sister. I got that dreaded call on Christmas Day to say she'd been rushed to hospital. She was unresponsive. The doctor in the resus where they put her said they need to admit her, but there are no beds. She spent 2 days in resus. After resus, they moved her to an area which was labelled ambulance drop-off zone, which we understood to be for people who'd come in an ambulance, needed to be admitted, but for whom there were no beds. She spent 2 days there. It was essentially a corridor, but with staff attached. But what happened on her first night there is that the man next to her was moved to the end of the road to make way for somebody new who needed to be coming in. And unfortunately, that night, that man died alone at the end of the corridor in his bed with no staff, out of sight of anybody. This she found traumatizing because she'd been with him. And because she was so traumatized, they moved her at 11:30 that night into an area that she describes as being in a lift. And she spent the night there frightened and alone. On day 5, she finally gained a bed on a ward. She says that at some points during her stay, she was wondering whether she would actually make it out of there alive. And to this day, she's still traumatized if she has to go back to that hospital for outpatient appointment. So it's a sort of ongoing harm. So for me, in September 23, I suddenly felt very ill and called 111. They did an assessment, told me to go to A&E, so I did, and I don't do that lightly. I had that night an agonizing 12-hour wait in the A&E while what was a kidney infection slowly turned into sepsis. In the morning, when I saw a doctor there, they said, unfortunately, they don't have the right department to help me, and I had to go to another hospital. My husband was with me and drove, otherwise, it would have been another 4-hour wait for an ambulance. At the second hospital, I waited another hour in their A&E, and then I was seen by a doctor in neurology. When I saw the doctor, he said to me there was no choice but emergency surgery. By this time, I was quite out of it and in no real state to understand what was going on. Because I went to hospital thinking I'm going to be given antibiotics and sent home. And instead, I ended up in emergency surgery. However, I am grateful that that emergency surgery did save my life. And I thank the NHS for that. But because I had been in sepsis, I then had to take up a hospital bed for 2 weeks to recover. That operation was a temporary fix. 6 months later, when I needed reconstructive surgery, the hospital couldn't tell me when that surgery would be scheduled and if even when I got there, whether I would get bumped off for cancer patients. So I had to pay £13,000 for the reconstructive surgery out of my pension fund. I had the same surgeon I would have had on the NHS in the same hospital, but in a private ward. And he used an NHS robot to perform the surgery, but it was at the weekend when the NHS weren't using it. I should not have had to pay that money for that operation because I've contributed to the NHS all my working life. And more importantly, what about those that can't pay? So that's what got me into campaigning. I used to follow Just Treatment on social media anyway, and then I saw this little tell us your experience button, which I filled in, and then Pope called me and said, come with us. So I did. So over that period, I've been involved in a fair amount of campaigning, which ranges from handing in petitions to the Department of Health, standing up and disrupting meetings where Wes Streeting is speaking or was speaking to journalists, making and sharing online videos. I was part of that action you showed at the beginning outside Parliament. And then we also went, a few of us, outside his constituency office some months ago, and our aim was to talk to his constituents and see what they thought about him accepting money from private donors. And we had a nice big banner with visuals about his hands in private pockets. To our surprise, he came out of his office and engaged with us. And it was then that he agreed to meet with us. And then, after a couple of cancellations, 2 or 3 weeks ago, we finally did meet with Mess Streeting. There was myself, another patient leader, Matthew, and a couple of colleagues, Wes and others, Hope and others from Just Treatment. I told Wes my story face to face again. I asked him to cap private providers' profits and not to award future contracts to companies registered abroad who pay no tax in this country. Matthew also asked him for investment to end corridor care. Before we left, we gave him a list of 10 demands, including the things we'd discussed face to face, but also beyond that, and asked him to respond. He said he would. So now he's gone. Now we have already written to James Murray, telling him of our meeting and our demands and asking for a response. It won't happen quickly, but we will not stop. This has to change. That's all I want to say. Thank you.
Thank you so much, Muge. Such a powerful, powerful story. We'll hear next from Claire, who's had, I think, similar experiences, and I think we'll speak to a little bit about Frontline 19. So Claire, would you like to unmute? Yeah.
Hi, thank you so much for having me tonight. So yes, as normally most people know me as the CEO of Frontline 19, but tonight I'm very much here as a patient's daughter. My dad is coming up for 80 this year and has worked in public sector his whole life. And unfortunately on Christmas Eve, just gone, he was taken into, sorry, forgive me if I get emotional about this because it's been a long 5 months. He got taken into A&E where we spent 30 hours on a corridor. And in that time, unfortunately, there were lots of people in lots of crisis, including a lady that had a significant mental health crisis. And I had to stand in front of my dad, who was on a trolley, for a good 8 to 12 hours with a chair in front of me because she was attacking people and they couldn't control the
Oh,
situation. And so I had the chair in front of me thinking if she comes to me, I'm literally going to push her back with the chair rather than her. It wasn't her fault. She was incredibly frightened. And I hope this is an okay kind of thing to share. It was like a frightened animal that was very, very scared and was lashing out at people. They didn't have the staff to manage the situation. There were people on ambulances outside, stacking up, and it was a very, very stressful situation for the staff. For me, I didn't sleep for nearly 30 hours. I was exhausted. My poor little dad, who also has dementia and a host of other significant health issues, was very, very poorly with a double fracture in his back. We finally got moved on to a ward the latter part of Christmas Day, I think it was, going into Boxing Day. And I thought, wow, okay, we're okay, we can breathe a sigh of relief. But unfortunately, that was when the problems really started. He was on a high dependency unit for 2 days, and then he got moved into a ward that specialised in dealing with patients with dementia and elderly care. And it was horrendous. There were people stacked up on the corridor. There were people on the corridor every single day for at least 5 months. He literally moved into a nursing home last Monday. And in the whole time that we were there were constantly people on the corridor. There were elderly patients in incontinence pants with genitals hanging out. It was undignified for them. I'd walk in the end with my head down because I wanted to try and give them privacy. There were people sobbing. There was a lady with her face very badly damaged. She'd obviously had a terrible fall. She was sobbing on the corridor. Staff were obviously doing the best they could, but the care was terribly substandard. My dad had a pressure sore on his bottom of his foot that migrated because of they didn't have the staff to look after things properly. So it migrated, and he has now got gangrene all over his foot and in several toes. He's had C. diff while he's in there. I cleaned fecal matter from out of his fingernails every single day for 5 months because they don't have enough staff. So he's had C. diff, he had norovirus, then he had hospital-acquired pneumonia where he had, I forget the correct terminology, but it was a pre-heart attack, and that happened twice. It's been horrific. And the problem is it's not just about corridor care. It is a corruption in the capacity, the safe capacity of a hospital. And what does that mean? My car can actively have or safely have 5 people in it. Just because I can fit 10 people in it doesn't mean that I should do that. And it's the same with this. It's dangerous. There aren't the right safeguardings in place to look after people or the staff. And it's a lose-lose situation for everybody in that space. You end up doing the basic needs of, brushing my dad's teeth. And as we know, infection can get in through the gum lines, and it's horrendous. And, the patients don't get fed properly. And there's all these other things that kind of roll on from this whole situation where the bottom line is we have too many people needing care and it's relying on too few staff. And the fact that you've got scans being done in corridors, I've seen that, people on oxygen in corridors, people having heart checks on corridors. None of this is okay. I went into a hospital this morning with my mum to have she had a very small procedure this morning, and there are people stacked up against the wall in a different hospital. The bottom line is it's not good for anybody, and morally it's incomprehensible that people are having to struggle with this on a daily basis. I did it for 5 months and nearly broke me and my family because it was so stressful. And it's not just about your loved one, it's about the fact that you're looking at other people and seeing how they're being treated and the difficulties they've had. And then, as obviously in my work with Frontline 19, where we support the NHS with free psychological support, we then have staff that come to us that are morally deeply distressed. The fact that people are dying on their shifts, Christmas Day with my dad, I was talking to an A&E staff member, and they were amazing. As you quite rightly said, they are the canary that's kind of, setting off the alarm here. One of the staff, she said something, I just said to her, look, I'm so grateful for what you've done. And she burst into tears, and I ended up giving her a massive big hug. And I said, look, you're doing the very best that you can. Nobody should be put in this position. In the meantime, the politicians are still allowing this situation to roll on. It's morally corrupt, and it's a corruption of what's safe and what's needed. So, if I can give voice to that and share my recent experiences with people that are deeply distressing, and hopefully create some change along with, the host of other people that are here tonight, then that's what I'm willing to do, because it has to stop. People's lives are in danger, and it's causing long-term harm physically and mentally to so many people within the system.
Thank you so, so much, Claire. That's really moving. Obviously, these personal stories are really difficult to talk about. So we really appreciate you sharing this, and to Muge as well. Thank you so much. And as Claire touched on, corridor care doesn't just put patients at risk, but it also has long-lasting and damaging impacts on health workers as well. Being forced to sort of try and provide best care you can in frankly unsafe and undignified conditions is, as we know, traumatizing staff. Um, so here to share some more insight into that is another member of the SOS NHS coalition is Dr. Andrew Myerson, who's an A&E doctor and the new CEO of Every Doctor, I think in a few days. So shout out to Julia, I think the former CEO, who's also on this call. So over to you, Andrew, and congratulations.
Thank you so much, everybody. It's great to join you. Can you hear me all right? I'm
Yeah.
gonna assume
Yes,
yes.
yes,
Cool.
we can.
I was hoping to take the call from home today, but I got stuck on my shift with a couple different things, and so I had to stay. Um, I'm really excited about joining Every Doctor. We are going to increase the collaboration with the SOS NHS Coalition. Um, I fully, and I'm looking forward to having a little bit more freedom over my schedule, fewer nights and weekends, and a little bit more time to devote to this. And just a note about that, I'm joining that, and I'm doing that. I'm stepping away from some NHS duties, about spending half my time going to be working on that, and half my time in A&E, because I firmly believe that we are one election away from losing the NHS. If we sleepwalk our way into this election, and if we don't escalate everything that we are doing to educate the public and to put pressure on our politicians, then we could easily wake up on election day years from now and lose everything that you guys fought for generations. And that those of us who didn't grow up with it recognize it as one of the greatest achievements that groups of humans have ever gotten together to achieve. It's just I've enormous gratitude for the NHS, and I love what I do here in A&E. But I have been having many more shifts where at the end of the shift I am just like broken. Seeing what we see, and I've worked in many different A&Es across London and in Worcester, and it's always the same issues. And it seems like for the last 20 years, no matter what health experts, um, people far smarter than me, have been yelling about for years, that we need to end austerity funding in the NHS. We need to have more hospital beds. We need to have a fix to social care. And that these are all the root causes for everything that we're seeing, all the problems that we're seeing in A&Es, and A&E very much is the canary in the coal mine. And I just want you. We've heard statistics, we've heard some patient stories, and thank you for everybody sharing with them. But I just want you to imagine, what it's like to be a patient on a trolley in a really terribly noisy, awful environment, because A&Es are awful environments. We get interrupted every few minutes. There's people crying and people arguing and people getting into fights and throwing stuff, um, and mental health patients who are, imagine this could be anybody could have a mental health crisis at any point in their life. And you can imagine that when that happens, A&E is the worst place for them. And we need a massive strategy, not only with bed staff, social care, and more NHS funding, but specifically for A&E to better deal with mental health patients, and to better deal with drug and alcohol addiction, because so many of the patients that we see have that part of their history when they're presenting. But if anybody thinks that this is just about a dignity issue, then they are dead wrong. This is about life and death. This is about 16,000 plus people dying every single year in this country from delays accessing NHS emergency care. And I'm quite fond of the aviation industry, because it seems like every time they have there's an error or mistake or major problem in the industry, they aggressively find and seek out those answers in order to save lives, to prevent harm from coming to people. And it feels like patients in this country and clinicians in this country are desperately trying to say, hey, we know how to save lives. We know how to save 20,000 lives a year. It just means that we know how to do that with better policy. And it just seems like we've had 20 years of government ministers not listening. And then you see what the end result of that. We are a deeply unhealthy population that desperately needs massive reinvestment in the NHS. And we have a government with Labour delivering austerity 2.0 yet again. Anybody that thinks that, and they're going to continue to defund, and this is true, they're continuing to defund all of our hospitals. There are more cuts coming, and I don't understand how any reputable politician who is being honest with the public expects to have a massive NHS recovery, given the state of our A&Es, given the state of our waiting list, given the state of funding commitments that have just not been met. And so, look, it is, and I'm sorry that I haven't been sleeping well the last couple of days, and work has been really, really tough, but it's not safe. And this is at A&Es across the country. It is not safe when we have to care for patients and your loved ones on trolleys, where we can't examine them properly, we can't hear them properly, where we have to talk about confidential things in a way that there's no privacy. It goes far beyond the lack of dignity, and that's the heartbreaking part of it. But this takes lives. And it delays care, and it means that there's yet another inefficiency in the entire system that prevents patients from getting rapid access care. And so, look, I'll leave it at this. But in the next couple of years, we will collaborate, we will escalate, and we are going to take the fight to the politicians, because just remember, when we're feeling down about all of this, we're right. The facts are on our side, the data is on our side, and together, a united coalition, everybody pushing in the same direction, we are going to change government policy, and we are going to save lives. And so, as difficult as it is sometimes, I know that with this community, we are going to do amazing work in the next couple of years, and we are going to escalate, and politicians will be afraid of us, because we are going to be fighting for patients, and we are going to be right. And so, thank you for joining the call. Thank you for everybody that's fighting, that's pushing in that direction, because all of us are going to have to this is an all hands on deck moment in NHS history, in British history. We're going to improve the health system, but we have to do it all together and stay focused. So thanks for joining the call, and I love you guys dearly, and I need a nap.
Thank you so much, Andrew. It's always so brilliant to hear from you. And thank you, obviously, for all the work you do as an NHS worker, and now even more so as an NHS campaigner. We're thrilled next, really, to be joined by Richard Bergen MP, who has been campaigning for greater investment in the NHS and working closely with NHS activists just like ourselves for years and years. He's going to speak about, I think, the efforts happening inside Parliament to end corridor care, and why this issue matters so much. So thank you so much, Richard.
Very much, Lucy, and what a wonderful speech by Andrew. I missed the speeches before then, but it was great to hear Andrew speak. Congratulations on your appointment to run Every Doctor, and also congratulations to Julia for the great work that she's done over such a long period running Every Doctor. I've got a copy of her book in the other room in my house just here. So great to see you all, and I look forward to working with you. It's good to see other friends and colleagues on this call as well. You know, this is an important event today against the corridor care crisis, as we've heard. I was proud to join your campaign launch outside Parliament earlier this year. I thought it was a powerful demonstration of what patients are facing each and every single day, and a powerful call for the investment that we need to end that situation, because it's completely unacceptable that so many people are left in the undignified and dangerous position of being treated in inappropriate settings. That's not right for patients, and it's not what hardworking NHS staff came into the profession to do. So I do look forward to continuing to back this important campaign in the months ahead. And let's be clear, this crisis is the direct result of 14 years of deliberate Tory neglect. Tory austerity plunged our NHS into a state of permanent crisis, and the government now has a duty to restore the NHS to the world-leading service it was before those damaging cuts took hold. If we look back to the last Labour government, one of its greatest achievements was the major improvement in NHS care after years of deliberate undermining. So it's vital that this Labour government learns the right lessons from that period. Those improvements happened overwhelmingly because of greater public investment. They didn't happen because of an expanded role for the private sector, as some now claim. It was public investment that drove the progress, and too often there was time and resources wasted on market reforms and private sector involvement, which undermined that progress. And so we need to avoid the mistakes of the past. We need to learn the right lessons about the role of public investment. We need to avoid repeating the costly mistakes of private finance and privatisation. Now, I've been deeply concerned by the direction the now previous health secretary, Wes Streeting, was taking. His closeness to private healthcare interests, the return of advisors like Alan Milburn, who was so linked to those disastrous PFI schemes, and the proposal to reintroduce private finance to fund new neighbourhood health centres. We can't save the NHS through privatisation. We can't save the NHS through marketisation. We can't save the NHS by pretending that AI is the answer to every problem, whatever Tony Blair thinks. And we can't save the NHS through another wave of private financing schemes. I would argue there's no room for private finance in our NHS. I've been campaigning in Parliament against Streeting's push to reintroduce private finance to fund new neighbourhood health centres, because under previous PFI deals, NHS trusts received around £13 billion in assets while being saddled with more than £80 billion in repayments. Decades on, around 80 NHS trusts are still trapped by those debts, despite having repaid the original loans. So using private finance once more would divert scarce resources away from patient care and into long-term debt repayments and private profits. Why would we repeat that, especially when the government has already acknowledged that PFI was a costly mistake? But truly learning the lessons of that mistake means ruling out these schemes altogether, not dressing them up under a different name. So in response to Streeting's proposals, I organised a number of roundtables in Parliament with NHS experts, academics and staff representatives against repeating the disastrous PFI experiment. And with Wes Streeting now gone, I believe we need to redouble our efforts to get rid of this policy once and for all. And I'll be writing to the new Health Secretary, James Murray, urging him to do exactly that. He's now got the opportunity to rule out the use of private finance for this new network of neighbourhood health centres, and he should take that opportunity. This is a chance to rebuild the NHS on the founding principles that inspired Labour to create it in the first place, and it would honour the party's manifesto promise that the NHS would always be publicly owned and publicly funded. So I look forward to campaigning with you all in the months ahead against these plans and continuing the fight for the level of public investment our NHS so urgently needs. Thank you very much.
Thank you so much, Richard. Obviously, we really appreciate all the work you've done and really appreciate you joining the call tonight. and look forward to working with you in the future. So we've heard a lot about the causes and impact of corridor care, but I think a key focus of tonight has to be spreading awareness about the sort of tangible policy changes that the government could and hopefully should get behind in order to actually bring this crisis to an end. So I think we're going to now hand back to John, who's going to take us through a few of those. So, John Puntis.
Thanks very much, Lucy. Yeah, so now we need to think about the solutions to the problem of corridor care. There's a lot of doom and gloom here, but as Andrew said, it's something that we can fix. And if we all work together and get our politicians on board, then the NHS, I sincerely believe, can be restored. So look, people on the front line and working in the NHS have identified the causes of corridor care, which I outlined earlier on. But just to reiterate, demand has increased. We've lost many beds. We now don't have enough beds. It's difficult to discharge patients from hospital so that they occupy beds which could be used for other patients, but there isn't support available for them in the community. But just let's talk about non-solutions first. So health ministers and NHS England are arguing that solving trolley waits is fundamentally an issue of local managerial leadership. They emphasise that hospitals can eliminate these delays or virtually eliminate them just with better flow of patients through hospital, earlier senior clinical decision making and proactive discharge planning. And in a recent speech, Wes Treating said corridor care had been much reduced at his local hospital, Queen's in Romford. And he said this was down to the trust leadership changing their model of care. They put a senior consultant on the front door of A&E to make swift triaging decisions, sending frail elderly people to other services. But the Royal College of Emergency Medicine, whose members actually manage overwhelmed A&E departments, pointed out that sending the least unwell people elsewhere is not the answer to reducing corridor care, because it's the most unwell people, including those with mental health problems, who fill corridors because they have to be admitted and there is nowhere else for them to go. So what is in fact required is a relentless focus on getting those who need admission out of A&E and into appropriate beds. And solutions must include the following. Get social care sorted out. Don't wait 2 years for the Casey Commission to report. This is urgent. Council funding, we know, has fallen by something like 26% per head since 2010. So in the short term, let's see more funding for local authorities so that they can expand community health and social care support in their areas. And that will mean that patients who are fit for discharge, except for needing community and social care support, will be able to go home. That could free up something like 1 in 7 beds, which would be a massive help. By all means, invest in rehabilitation and step-down services. That is happening in some places, but it needs more investment in those things, again, to facilitate discharge and things like discharge coordination teams. But we also need to rebuild primary care, invest in general practice. The number of full-time equivalent fully qualified GPs has actually fallen since 2015, whereas workload has gone up considerably. And we need something like 5,000 more GP posts to give primary care the capacity it's needed. Labour has delivered a limited number, probably about 1,300 full-time equivalents, but we need a lot more. This has to be a drive to reinvigorate and staff general practice. And we're in a ridiculous situation currently, as people will know, where there seem to be hundreds, if not thousands, of qualified GPs who cannot find work because the practices don't have the money to employ them. We also need to focus on expanding and retaining the emergency care workforce and funding the reopening of NHS beds with the staff needed for them. The UK has fallen way behind comparable countries in terms of beds. We have about half the number of beds per thousand populations compared with other European countries. And I think we need to have a radical think about workforce planning. Some of you may know that the new health bill, Wes Streeting's parting gift to the NHS, anticipates fewer staff in the NHS and, surprise, surprise, greater reliance on artificial intelligence. This is not the right approach. It's techno optimism without an evidence base, and it's not going to be good for patients or staff. We've just released a petition calling on James Murray to reject these proposals, and I hope people will sign that petition. And finally, just a last comment. We need to adopt a zero tolerance approach to corridor care. It is not acceptable. It didn't happen even 10 years ago. It was really rare. Don't normalize it. Don't pretend that a 500-fold increase is down somehow to lazy staff and managers who've taken their eyes off the ball. See it as the systemic problem that it is, and this needs to be grasped by government at national level. Thank you very much.
Thank you so much, John. Yeah, loads of really, really great ideas there. And I think it's so important to hear that because I feel like we often get the vibe from politicians, not all politicians, Richard, I'm not talking about you, but from many politicians that, it's simply too hard. It's too much of a big problem to fix. It's to do, we don't have the money. It's to do with Iran. It's to do with this. It's to do with whatever. But actually, there are just concrete, tangible policies that this government could be pursuing if they were genuinely, genuinely committed to that pledge of ending corridor care by 2029. It's not just going to happen by saying that you want it to end. It's going to happen by actual concrete, tangible action. So yeah, we're coming towards the end of the call tonight, but we didn't want to finish without sharing a concrete action that all of us can take right away. So we've set up a new MP letter writing action, which enables constituents to write to their elected representatives, ask them how their party would end the corridor care crisis, and urge them to commit to concrete forms of action to increase the pressure on the government to act. So the email will also share a link to our SOS NHS briefing on corridor care so that MPs will have access to a range of key information and policy proposals, many of which John touched on just now. So we need as many people as possible to take this action, and also please report back on any responses you receive. That way we can start building up a kind of picture of where exactly different parties stand on this issue and which politicians are open to working with us to push for action, just as Richard is, and hopefully many of his colleagues will be as well. So I think Lucy's posted the link in the chat. Now we'll also send it out via email to our various mailing lists across the SOS NHS coalition. I know that a lot of people often find it slightly depressing to continue to write to MPs because sometimes MPs don't respond, and appreciate that can be very frustrating, but this is one of the most effective ways to ensure that MPs cannot ignore these issues. If they do, it does matter if they hear from hundreds or thousands of constituents about these topics. So we do just need to keep pushing in this moment. So please do take that action if you can, so that we can keep corridor care at the top of the political agenda and not let it slip. And secondly, we're also always looking for stories of patients who have been directly impacted by corridor care, whether it's you or a loved one, as these voices and testimonials are one of the most powerful campaigning tools that we have. They cut through in a way that statistics and policy alone just can't. So if you have a corridor care story to share, please fill out our simple and secure story form. We'd really love to hear from you. And I think Lucy's going to be sharing the link in the chat as well. But again, we'll be sending it out via email. Yes, so that about brings us to the end of our webinar. Miraculously, 6 minutes earlier than we planned. This is often unheard of in left-wing calls, and I think we should all be very proud of ourselves, and the speakers should be very pleased that they stuck to their time. So yeah, a huge thank you to our amazing lineup of speakers for their really powerful contributions, and to all of us, all of us for joining together online this evening. It's thanks to the efforts of so many different groups in the SOS NHS Coalition and beyond, and thousands of people like you, that the issue of corridor care is getting more coverage and more traction, and the government are no longer able to ignore it. But as we said tonight, words alone are not enough. So now is the moment to really ramp up the pressure on politicians to take some meaningful action. So in the weeks and months to come, the SOS NHS Coalition will be sharing more campaigning actions and ways to get more involved in the fight. So do keep an eye out for more updates. But yeah, that brings us to the end of the call. So thank you so much, everyone. Lovely to see you all. And yeah, take care. Bye, everyone. Have a good evening. Enjoy the sun.
Bye bye.
Bye bye.